Namaskar and welcome to Sunset Television. I am Vishal Dahiya and you're watching our show Perspective, where we bring you detailed analysis of key national and international issues. Today we're going to talk about common drugs standards. Now, according to reports, Union Health Ministry is considering formulating common standards for drug regulators at the centre and in states as well, and maintaining a central database to better regulate the manufacturing, sale and distribution of drugs. Now, this will involve harmonization of regulatory requirements, processes and procedures along with databases across all states to ensure consistency in the evaluation and approval of drugs. In February this year, in fact, Health Ministry had also conducted a two-day brainstorming session with discussions on how to make the country's drugs regulatory system transparent, predictable and verifiable as well through principles of uniform standards, sturdy structures for compliance and enforcement and capacity enhancement as well. Indian pharma companies have enabled by their price competitiveness and good quality have made a global mark with 60% of the world's vaccines and approximately 20% of the generic medicines coming from India. India, in fact, ranks third worldwide for production by volume and 14th by value in the pharma sector. So today we'll discuss and analyze not only about India's pharma sector, but also these new initiatives which are being discussed and why are these initiatives important? What will they bring on the table? And for more on this, we're joined by a distinguished panel of experts from this particular sector. Let me first introduce them to you, beginning with Mr. Yogendra Kumar Gupta. He's joining us. He is the National Scientific Coordinator with the Pharmacovigilance Program of India, that is PVPI. We're also joined by Dr. Sanjay Singh, Director and CEO of Genova Biopharmaceuticals, and Professor N.K. Ganguly, former Director General of Indian Council of Medical Research, that is ICMR, along with Mr. Harish K. Jain, President of the Karnataka Drugs and Pharmaceuticals Manufacturers Association, is also with us. Welcome, all of you gentlemen, as well to Sunset Television. I'll first begin with you, Mr. Y.K. Gupta, and let's first start by understanding, why and how of these new initiatives which are being discussed in terms of bringing in uniformity on various aspects, be it the databases or be it the processes.
I would say India has already achieved the distinction of being called as the capital of generic hub, and we are distributing the drugs. We are supplying the drugs to more than 170 countries across the globe. And therefore, it becomes very important that not that we are known as the generic drug hub, but we should also be recognized as the hub of a quality drug. And that is important, that we continue to strengthen our quality assurance mechanism, and so that the public in India or throughout the globe gets confidence in our drugs. And therefore, it was decided to do a brainstorming or a Chintan Shivir, in which the idea from stakeholders, maybe the industry, regulator, academicians, to see that wherever possible, what are the steps which need to be further strengthened. So this is a very welcome step by the government, in which a free and frank opinion discussion was done, and wherever there is a possibility to improve the quality, to improve the confidence, to build the trust, and to do some innovative things by which all these things can be done was discussed in today's meeting.
Okay.
So that's the reason.
Okay. But Mr. Gupta, when we look at the present system, there are 38 regulators, including from state and union territories and the central, drug regulatory mechanism as well. How does it work? How does it function? What is it that we are looking forward to in terms of bringing uniformity? It's just the sharing of database information about all, pharma manufacturers, or some other compliance measures as well? We are looking at a uniform, playing field or uniform ground.
This is something very important which you raised. I would just suggest 2-3 points here. The federal agency, that means that DCGI office, is the organization which gives an approval or no objection for any new drug. However, the license for manufacturing and sale is given by the state drug controller. And therefore, it is important that there is a very close coordination between the center and the state regulator. If this is not there, then any deviation, any minor changes in the drug, the regulator does not have an idea that what the state drug controller has approved. And therefore, that is the first thing, that there has to be very strong networking of the what the central drug controller and the state drug controller is doing. Number two, there are more than 10,000 manufacturers of the drug companies, from big to small. And these small companies or big companies are given license by the state drug controller. It is important that any drug company which is giving license to manufacture is also captured by the database of the central authority. And therefore, one of the important recommendation which is going to be done, which is already committee has been set up to map, to do the registration of in a portal of all the manufacturers in the country. And that is very important. So that is done. The second thing is that the quality assurance, which is responsibility of the different labs, is done by the state drug.
Okay.
And the state drug controllers should be empowered by having a capacity to do the testing, by reproducibility of the testing, by using the reference standard which can be supplied by the Central Indian Pharmacopoeia Commission. That is done. And therefore, capacity in terms of infrastructure, in terms of human resource, in terms of reproducibility, and most importantly, the training of the human resource who is doing this has to be accredited, has to be very intensive. And that's why this entire process of the things are being strengthened. I do not say that they doesn't exist. They exist, but there need to be strengthening of these systems.
Okay, further strengthening of these institutions and these mechanisms as well. Let me bring in other panelists here as well. Professor Ganguly, I'd like to start with you. In terms of your views, having seen these processes at as close hand, in terms of the entire mechanism which we have, entire regulatory system which we have put in place, what are the areas which need more improvement? What are the areas which need further enhancement? Be it the processes or procedures we talk about, or the uniformity in terms of sharing of information between various regulators?
Actually, we have in India those systems. Only we are now discussing that how these systems could be done in our form of regulation. In our form of regulation, there are state regulators and there's central regulator. When we have generic drugs, which is totally described, it is cleared by the state regulator. They may not go to central regulator. And sometimes it creates problem in the standards. Standards are described by the Indian Pharmacopoeia Commission, or there are US Pharmacopoeia, British Pharmacopoeia. There are several pharmacopoeias. They provide the standards. And in these standards, the problem is that for many things, like when we were doing the filaria program, we found that the DEC, which is manufactured in India, that DEC had a problem in the dissociation.
Okay.
So the ISI from the Japan, we started getting this. Globally, we started getting this. The same way, there are some important thing about the PKPD, pharmacokinetics, pharmacodynamics. These are very, very important. And batch to batch, these need to be seen. The bioavailability, etc., are very, very important. I give one example. Like if we make a liposomal amphotericin B, which is very important for fungal infection and others, it could be given by the state regulator. However, this is such an important thing that its appropriate concentration, its slow release, many such things are important. So here, what is being attempted, that state regulation as well as the central regulation is harmonized in a way that all throughout the qualities are maintained. So this is a very good attempt, and it will create a lot of problems from India, particularly those who export drugs outside, and there will be there will be uniformity. And one more thing I want to say, that there are other important things in this particular thing, that there are now many green technologies. So these green technologies need to be done for the manufacture so that environment is also protected.
Okay.
India is very strong in the fine chemicals. India is also now has to really gear up for APIs, where there are APIs where 100% we are getting from China or 80% we are getting from China. The same parliamentary committee has also
Indeed, yes.
that we strengthen and make our API. So API, and they have given it to CSIR, which has got most of the chemical and drug labs in the country. So these are some of the things which have come up. And one more thing which has come up, that in the devices, now there will be central. There is no doubt on this, that all devices will be centrally cleared. Mm-hmm. So if we take all of these things, it is a very nice thing that we will have appropriate related substances, okay. We will have dissociation, we will have appropriate hygroscopy in the things, PKPDs, bioavailability, all of these will be standard in India.
Okay, okay. So holistic move there, Professor Ganguly. I'll come back to you, but holistic move, as you're pointing out various aspects, ensuring that we increase the quality standards of our drugs which are manufactured here in India. Let me bring in the industry perspective here as well. Dr. Sanjay Singh is with me. Mr. Harish Jain is also there. All of us are aware, how the Indian pharma industry has lived up to the promise and made its mark globally as well. Over the years, and specifically during the COVID pandemic as well. But Dr. Singh, from your experience as part of the industry, how would you describe the current processes which we have and the kind of changes which are being talked about, as both Professor Ganguly and Mr. Gupta were mentioning?
So, thank you, Mr. Dahiya, for having me into this discussion. This is very, very important subject, because healthcare touched each human life, locally, internationally, both. So what is happening that with time, the science is improving, the analytics is improving, the computational power is improving, the reach of medicine is improving globally. In the same way, we have to also look from a different perspective, that whether we are taking care on the safety, we are providing the enough regulations which should not be over or which should not be less, but adequate. Because in drug business, the first comes safety, the second comes efficacy, the third comes affordability. So these things are very, very important. Going forward, if we create a one single window system, like we have the corpus is lying with our central regulatory authorities, and then next level up comes to the state level, I think this is one of the major changes happening in last 30, 40 years. So what kind of pharmacovigilance should be available? Because it is not only the quality of drug standard or quality of the drug is available, also it is equally important, and where Professor Gupta is a part of that, how we are also doing the pharmacovigilance. And this is going to, if we improve these points, this is going to improve our acceptability in global market too. Because we are catering one part of the local market, but also two parts which we are producing, it is going to the global market. So I think this is a very welcome step from the government, and how we can make, again, safe, effective and affordable medicine, and which is supported by a lot of data integrity or data systems under the government. Thank you.
Mr. Jain here as well. Mr. Jain, how would you describe, because, at the state level, we're talking about this harmonization between the state regulators, between the central regulator, and in fact all state regulators as well combined, when we look at a uniformity in terms of the processes, in terms of procedures, in terms of databases as well, so that we improve our quality standards?
I think, thank you for inviting me. I think my view is like uniformity everywhere in the implementation of the Drugs and Cosmetics Act, whether it is licensing, whether it is the distribution or the whole supply chain. It's a need of the hour. And today the information technology is so much developed, we should be able to get all the information on a click of the button. I think that should be the aim of the government, and I'm sure that during, as Professor Y.K. Gupta ji has said, during this Chintan Shivir, it was agreed, and most of the drugs controllers have agreed for this kind of a mechanism where the information is available, the central database is available. Now, the thing is, historically speaking, the drug regulations comes under the health ministry, which is a concurrent subject under the Constitution of India. So normally what happens is, historically what has happened, the the union government makes the rules, policies and act which are being implemented or enforced by the state governments through the state drugs controller. Now that is where what happens sometimes, due to the lack of information or due to the lack of, probably I would say, the lack even at the drug regulatory system creates a kind of a mismatch. Now today the IT is so much of developed that we can always create a portal to store this huge database. We have almost like 300 manufacturing companies having around 10,500 manufacturing plants, and you should be happy to that.
Okay.
We have, India has the FDA approved plants, which are, in fact, we surpassed the numbers even from the US itself. So as the quality of the India is concerned, we are sure we are the best. Even the number of plants what we have, the kind of plants, the manufacturing modern plants we have, we are the best. Now here, if you're looking at here and there, see basically when you look at the quality of the product, it's not only that there is a problem with the manufacturing, it's also a problem with the storage systems what we have, the kind of good distribution practices which are being followed within this country due to lot of limitations what we have. I think that needs to be strengthened, and the state regulators, if you look at it, they have the foot on the ground. We have thousands of state drug inspectors which are working for us, so they have the foot on the ground. I think that has to be, I think, that constant training from the central government to take an initiative where how we can utilize the kind of the trained manpower what we have with us, and that has to be used. Without tweaking much into the regulatory system, we should have all the kind of uniformity where every regulator is on the same page. I think that's the need of the hour, and the industry will definitely welcome it. I think because it creates a new kind of opportunity for us.
Okay. Indeed. Let's also, bring in Mr. Gupta again here. Mr. Gupta, what are the timelines which we are looking at? Because in the month of February, all the stakeholders had a long winding discussion about how to go about it in terms of what needs to be done. And this is March we are talking about. How long before we are able to, put in place these reforms in the processes which we are talking about?
I think, irrespective of timeline, it is important that the spirit of that, and it has already been decided. The action has already started. And I would say that within 6 months, the impact of this will be visible. And I will just add one thing here also. Like I chair the Signal Review Committee of Pharmacovigilance Program of India, where we collect the adverse drug reaction of any drug or any product, and then the committee sits and decides, yes, this adverse drug reaction is important, should be communicated as a policy decision to the regulator. The regulator then makes a caution, precaution and indication change of the product and communicates, the DCGI communicates the state drug controller. The state drug controller passes this information, or should pass this information, to the manufacturer, and the public should be aware of this. Now, this chain can be only effectively working if there is a very effective coordination within Indian Pharmacopoeia Commission, Pharmacovigilance Program of India, the central drug regulator, and the state drug controller. So this net has been strengthened. And now if we say the Pharmacovigilance Program of India said that a drug or a formulation has produced this side effect, people should be cautious, or this side effect, and therefore there should be an indication of warning on the product. And this is sent by the the DCGI to the state. And then we get the feedback now, already started that yes, this change has been implemented. That is the effective thing. And this is what I'm saying, timeline, because this has already started. So the timeline, irrespective of mentioning timeline, the success is showing it. The training component is the planning of the training. The 1 day addition, the joint drug controller is also being made in charge of the training program, and this training in analytical process, in pharmacovigilance, in translation of this pharmacovigilance, capacity building has already been started.
Okay.
Now the different schedule, the modules of the training are being worked up. So I think this is something very good and a very good initiative where, as Dr. Jain and Dr. Sanjay have said, that this will involve the participation of industry as well.
Okay. Okay.
And so this is something very good has already started.
Indeed, it will involve all stakeholders there as well. Let me, quickly take one response each from Professor Ganguly and Dr. Sanjay Singh as well in terms of what more needs to be done. Professor Ganguly, you were also talking about various aspects, and as you know, Mr. Gupta is mentioning, it's not just about the processes, but it's about the manpower as well, the training, the capacity enhancement also. So all things will have to work in tandem with each other, and it looks like the wheels have started moving.
We need to have many more testing labs and testing inspectors. And there is a committee. I was part of that committee. The Mashelkar committee has created a set of recommendations which covered all of this. And that Mashelkar committee thing has to go through parliament and get approved. I think a speedy approval of that will be good. Another point which I want to make as my last comment, that one of the recommendation is the people's involvement into this. And this is something very good. When people get involved, the government gets a third-party evaluation and third-party comments. So this is something in these recommendations which is very, very good, and I welcome that. But the timeline will not be easy. It will not happen tomorrow or day after tomorrow. It will be a gradual process, and it should be a gradual stepwise process so that we do it correctly, and whatever we do it right. Okay. And the political discourse and political process will also be important.
Okay. Indeed, whatever we do will have to be done in a correct manner there as well. Dr. Singh, quick concluding comment from you in terms of what is that that industry can bring to the table, because as the other two gentlemen were pointing out, all stakeholders, specifically the industry, will have to be on board for sure and put in the best foot forward, be it in terms of ensuring compliance or training of manpower as well.
Yeah, so from industry standard, we have to be very efficient, we have to be very effective, and policymaker has to have a tight control on this process. So it is all welcome decision. Only these things happen fast, these things happen effectively if the political will is there. And this Chintan Shivir shows that political will has demonstrated that we have to put these things into the perspective. And I think it is moving out, and industry is fully supportive, because this is going to give us the good one, which are the good ones. This is going to give extra credibility, not only in India, but globally. So for industry, this is a very welcome decision.
Okay, Mr. Jain, your view there, you also represent industry, the state of Karnataka there, the manufacturers, and most of them are present in the state.
So what my view is, our whole business depends on the credibility of our products. Now, when we say about the credibility, not only that we have to make the quality products, but then our consumer, the patient, should also perceive that what is he taking. He has a confidence and the quality of the product. So whatever steps are being taken to generate the confidence on our products in terms of whether we are talking about the bioequivalence, or we are talking about the content of the drug, or we are talking about the impurity profiles.
Okay.
I think all the steps it's a welcome step. And today, I think when we talk about the Indian pharmaceutical industry, although we are third largest in numbers in terms of volume, we are only the 14th largest in terms of value. So there is a lot way to go. I think once the confidence develops, it also opens up our opportunity to get into innovative dosage forms and new chemical entities. I think that becomes, whatever decisions are now being taken, that becomes a stepping stone for a larger growth.
Okay.
Now, India has a very ambitious target of reaching $130 billion by 2030 and $425 billion we are talking about by 2045. Now compare that with the global volume, which is global business, which is almost like currently we are looking at $2 billion. I think we are just a minuscule part of it, and we are catering only to one particular segment, which is mostly generics, which is only 10% of the total market share. Now, once we develop all these kind of capabilities and we become a kind of a global leader, I think the sky is the limit.
Indeed, indeed. There are going to be a lot of avenues there. Thank you so much, Mr. Harish Jain. Once we put all the processes in place, a lot more opportunities, a lot more avenues will open up, specifically when we're talking about buy value and in terms of quality as well. Thank you so much, Dr. Sanjay Singh as well, Professor N.K. Ganguly and Mr. Y.K. Gupta also for sharing your views and insight. Those were our experts from the pharma industry and pharma sector. Expressing their views in terms of what needs to be done when we're talking about improving the standards, the quality, bringing in uniformity and acquiring more space in the global business when we're talking about the pharma sector. We'll come back again with a different topic. Till then, keep watching Sunset Television. Thank you.